Good afternoon, and thank you for tuning in. It is Friday, January 8th, and of course I'm with Dr. Caldoun. First, I want to start out by saying how grateful I am that all of Michigan's congressional delegation, their staffs, and so many who work at the Capitol are safe. The events that unfolded 2 days ago, just 2 days ago, were appalling and scary. Over the summer, last year, when millions of Americans peacefully protested the deaths of Breonna Taylor and George Floyd and countless other Black Americans, they were responded to with tear gas and rubber bullets and called thugs and criminals by leaders like President Trump. And Wednesday, much like when he stood on the national debate stage and told white supremacists to stand back and stand by, the president spoke directly to the group of domestic terrorists who stormed the Capitol, and he doubled down on his dangerous Election Day conspiracies and said, "We love you and you're very special." Had the group of people who stormed our nation's Capitol been Black Lives Matter protesters, it's logical to conclude they would have been treated very differently. Wednesday was a dark day in our country, and unfortunately, it's a sight that was too familiar, especially to us in Michigan. We saw events like this play out here months ago in our own state. Some of these same people that were in DC were the same that were here at our Capitol, coming in with weapons to intimidate lawmakers. Some of them were even implicated, some of the people that were at our Capitol were implicated in the plot to kidnap and kill me. They stormed the United States Capitol this week to intimidate lawmakers at our federal level. 8 months ago, I called on President Trump. I spoke with Vice President Pence. I reached out to the Republican leadership here at our Capitol and asked them to help bring down the heat. None of them did a darn thing. And here we are, a really tough moment as a nation. While some Republicans have spoken out in the last 24 hours, we need more everywhere to stand up and say domestic terrorism will not stand. Whether it is directed at a governor or Dr. Fauci or Secretary of State Benson or the Georgia Secretary of State or the United States Congress. This nation was founded on democracy and honoring the will of the people. We cannot forget that we are Americans first. It's time to come together and to put this election behind us once and for all and focus on our common enemy, this virus, COVID-19. As Americans, there is no problem we cannot solve if we work together. So let's get to work, working together. Today, my administration is announcing a goal that all school districts offer an option for in-person learning no later than March 1st and earlier if possible. The value of in-person learning for our kids is immeasurable, and we must do everything we can to help our kids get the great education they need and to do so safely. Over the last 9 months, medical experts and epidemiologists have closely been following the data and know now that schools can establish a low risk of transmission by ensuring that everyone wears a mask and adopting careful infection prevention protocols. It's critical that we take a fact-based approach by doing things like wearing masks, washing hands, and practicing social distancing. As rapid testing access expands, we have even more tools to make schools safer for students and educators and other staff. My administration has worked with the Michigan High School Athletic Association to pilot a testing program in 200 state high schools that has largely been successful. And on Wednesday, I announced that school and child care staff will be eligible to receive the COVID vaccine beginning this upcoming Monday. My administration is working closely with school officials and community leaders to ensure schools can operate as safely as possible. I strongly encourage school districts to provide as much face-to-face learning as possible, especially for our youngest students, especially for economically disadvantaged students, and students with special education needs and English language learners. Some families will choose to send their kids to school when that's an option. Others will choose for their children to continue learning remotely. And some educators meet the CDC definition of high risk, and we will continue to support these groups that wish to continue teaching and learning at a distance. We know that in-person learning provides a key benefit for many parents who rely on their children to be at school so that they can do their work and participate fully in our economy. Many students and families have struggled with remote learning and need opportunities for face-to-face interactions with educators, even if it is a hybrid schedule to allow for smaller groups to gather. Every parent deserves to know that their child will be safe and learning in the classroom. Every educator and every member of our school support staff deserves to know that they are safe at work. On top of testing and vaccinations, we will work with districts to ensure that when schools begin in-person learning, safety protocols like mask wearing, hand washing, and social distancing remain in place. Many districts across our state have been largely open for face-to-face instruction since the beginning of the school year. They should not stop now. These schools have demonstrated that they can provide a safe learning environment for their students and safe workplaces for their staff. The plans that these schools developed with teachers include strong infection control measures, and those plans are working. So I encourage these schools to continue implementing their plans and operating safely to the greatest extent possible. I have incredible respect for our teachers. The teachers and educators who've been working in person over the last several months are true frontline heroes, and we are grateful. Since day one of this pandemic, educators have stepped up and led, providing our students with the best support and best education under the circumstances. They've managed to continue lunch programs for those who rely on them. They've provided emotional counseling for the countless students in need of it. And they've ensured that our students received the academic support necessary, whether that was being done remotely, in person, or both. I want to again thank all the educators who've worked tirelessly to serve our children. I will not stop working for you. So this is good news for our students and our educators and their families. My administration will continue working around the clock to distribute the safe and effective COVID vaccines. But we need help from the federal government to get it done. Yesterday, I, with 7 other governors from across the country, sent a letter to the Trump administration requesting that they distribute the millions of safe and effective COVID-19 vaccines that they are currently holding back in freezer farms like the one in Portage, Michigan. According to publicly reported information, the federal government currently has upwards of 50% of current produced vaccines held back by the administration. Today, the incoming Biden administration announced that they will release available vaccine doses that the Trump administration is holding back. I'm hopeful that the Trump administration will do it sooner rather than waiting for the new Biden administration, because it will mean that we can get more vaccines distributed and put an end to this pandemic sooner. My colleagues and I across the nation are grateful that the Biden administration is committed to this and hopeful that the Trump administration will take this action. Michigan and states across the country are ready to work around the clock to continue ramping up distribution, to get more shots in arms, and to save more American lives. But we need the federal government to take action. Over the past year, Michigan has emerged as a nationwide leader fighting this pandemic, getting our economy back on track and saving lives. and now we're working to cement our status as a national leader in vaccine distribution. On Wednesday, the CDC released new data that shows Michigan in the top 15 states when it comes to vaccine distribution. Dr. Khaldun and I will continue working 24/7 along with our incredible teams in state government and in local government and across the state in hospital systems, et cetera. It's going to take hard work, and it's going to take collaboration, state, local, federal governments, businesses, local health departments, and everyday Michiganders. But this is Michigan, and I know we're going to finish what we started. Thank you, and with that, I'll hand it over to Dr. Khaldun.
Good afternoon. Thank you, Governor. So as of yesterday, the state of Michigan had 512,751 cases of COVID-19 and 4,015 deaths due to this virus in the state. So here's where we are with the key metrics that we are tracking. Our case rate is at 222 cases per million people, and that's an increase of 8 cases per million in the past week. Our percent positivity is now 9.3%. It's continued to increase over the past week and was 8.2% on December 27th. 12.8% of available inpatient beds are now filled with patients that have COVID-19, and that number continues to trend downwards. So our metrics overall tell me that we are at a pivotal moment. The declines we were seeing prior to the holidays seem to be reversing. And I'm concerned that there were gatherings over the winter holidays, and we're starting to see the results of that. And I'm very concerned that it's only a matter of time until we see a new variant of this virus in Michigan that originated in the UK and has caused a dangerously fast increase in cases there. This variant is transmitted more easily, risking a significant increase in cases, hospitalizations, and deaths. But it's not too late. There's still time for people to do their part to stop the spread of this virus in Michigan. Even if you traveled over the holidays, you can be quarantining at home for at least 10 days after you return, so that if you do have the virus, you don't spread it to others. If you've traveled over the holidays, and if you know you've been exposed, or if you are having symptoms, please get a test. And you should mask up and mask right. Wear a mask properly over your nose and mouth anytime you will be around anyone outside of your household. This protects you and it protects others. Today, as the governor mentioned, we're releasing guidance for schools to help them understand how to bring children and staff back to school in the safest manner possible. As a parent, I know how hard it has been to not have children engaged in in-person learning. This can have negative impacts on children's academic achievement, their mental, and their physical health. It is especially challenging when parents have to figure out how to work and take care of children who are home all day. We want every school district to be working with their local health department to identify the safest way possible to provide in-person learning. And we've set a goal, as the governor mentioned, for every student in the state to have this option before or by March 1st. Things like appropriate spacing of desks, wearing masks, a cohorting of students, and adequate ventilation significantly decrease the risk of virus spread in schools, and is how many students across the state are already engaging in in-person learning today. Starting Monday, K-12 teachers and childcare staff will be able to start getting vaccinated. And this is another important tool to help prevent spread of the virus and to keep our kids in in-person learning. And our updated guidance for schools can be found on our website at michigan.gov/coronavirus. So vaccinations are accelerating across the state. Through the end of the day on Wednesday, there were 174,749 doses of vaccine administered across the state. Over 24,800 doses were recorded on just Wednesday alone, which is our highest number yet since we started this effort. And I know many more have occurred since then. I am pleased that I was actually able to get my second dose of the vaccine yesterday. These vaccines are safe and effective, and I have comfort now in knowing that I am now highly unlikely to bring this virus home to my family or to spread this infection to my colleagues in the health department or in the emergency department. Today, I'm actually feeling well. My arm's a little sore, and I know it's possible, especially with my second dose, to not feel well in the next day or so. But I know that if that happens, that's because the vaccine is working. And I encourage everyone to be patient, but please do sign up for an appointment for a vaccine when it becomes available to you. So on Wednesday, we also announced that the state of Michigan is moving forward with phase 1B of its vaccination plan. And we're pleased that starting Monday, local health departments and health systems may start to offer the vaccine to those who are over age 65 and some essential frontline workers. So K through 12 teachers, as I said, first responders, and workers in prisons, jails, and shelters. We're glad to be able to move this forward, but I really want people to be patient. This is not like a flu shot. You can't just walk up to a facility or call and demand a vaccine. Unfortunately, you will not be able to get it that way, and you will be turned away. There is simply not enough vaccine today that has been given to us by the federal government for that to work at this time. So what should you do? First, you should check the Michigan Health Department website at michigan.gov/COVID vaccine. We'll be regularly updating that website with information about the local health departments that may have vaccine available to you right now if you are eligible. You will find links to those health departments with information on how to schedule an appointment if one is available. If a health system has a vaccine appointment available to you, they will contact you directly. If a local health department is not listed on our website, they are not yet ready to accept appointments for the vaccine. We don't want people to be frustrated by this. We know this will happen because we just don't have enough vaccine in the state. And I ask for patience as our health systems and our local health departments accelerate their efforts to provide the vaccine to as many people as possible. If you're now eligible for the vaccine because of your line of work, please be patient as your employer also works with the state and local health departments to arrange where your vaccination will take place. And they will notify you when the plan is finalized for how you will receive the vaccine. So we do have to be patient, but we still have things that we all can control. Protect yourself and others by masking up and masking right. Wash your hands frequently. Get a test if you are exposed or if you're ill. And when it's your turn, please do choose to get the vaccine. We are on the right path to end this pandemic. And with that, I'll turn it back over to Governor Whitmer.
All right, happy to open it up for a few questions for either me or Dr. J.
All right, great. Governor, the first question will come from Tim with WILX.
Hi, Governor, does the March 1st start mean that you're confident we'll get enough of the vaccine to vaccinate everyone in this second phase like teachers before then?
I think what March 1st signifies is that we have learned we can pursue in-person instruction safely, that we've got a lot of schools that have been doing this and they've been successful even before vaccines were imminently on the horizon. And we're grateful for how seriously they took the protocols and how well they've been able to keep people safe. We have expedited, of course, our putting teachers into the group that is eligible for getting vaccinated, and we are hopeful that as vaccines continue to ramp up and as we move even quicker, the systems are being built as we do this. It's really, I think we've made incredible strides. And I do think that we will have a lot of our education workforce vaccinated in the next month or so, and that's our great hope. And the incoming Biden administration has acknowledged that they will be using the DPA and